A stark reality awaits Californians who rely on the state's health insurance marketplace, Covered California. The upcoming year brings a significant premium increase, averaging a staggering 10.3%. This news, announced by Covered California officials, marks the first double-digit rate hike since 2018, and it's a result of a perfect storm of factors. But here's where it gets controversial. The primary driver of this increase is the rising healthcare costs, which insurers have been anticipating at an annual rate of about 8%. However, the expiration of enhanced federal subsidies, a key component of the Affordable Care Act, is also a major factor. Covered California Director Jessica Altman highlights this, stating that policy-driven market uncertainty is fueling the hike. The impact of these changes is twofold. Firstly, the loss of federal financial assistance, which expires at the end of the year, accounts for approximately 2% of the rate increase.
Secondly, President Donald Trump's One Big Beautiful Bill Act left out funding for enhanced premium tax credits, which were crucial during the COVID-19 pandemic to ensure widespread health insurance coverage. And this is the part most people miss. Congress has the power to renew these subsidies in September, but if they don't, California stands to lose a substantial $2.1 billion in enhanced tax credits for consumers. Certified health insurance agent Ariana Brill, who assists people with Covered California enrollment, paints a grim picture. She predicts a double whammy for consumers if the enhanced subsidies aren't renewed. Rates will increase and assistance will decrease, leading to a considerable rise in the net premium that consumers will have to pay. Brill's concerns are well-founded. Open enrollment typically starts in November, but clients are already expressing worries about the impending increases. If Congress doesn't extend the enhanced subsidies, a majority of Brill's clients, approximately 2,600 people, will face significantly higher healthcare costs. So what does this mean for the average person? For many, affordability is a critical factor in decision-making. As Brill puts it, very few of us have the luxury of buying things without looking at the price. In an effort to mitigate the potential loss of federal subsidies, state officials have taken steps to support the lowest-income Covered California members. The state will invest $190 million to maintain subsidies for individuals earning up to 150% of the federal poverty level. However, this investment falls short of the $2.1 billion that California stands to lose. The consequences of these changes could be far-reaching. Experts warn that the loss of subsidies and rising costs could lead to approximately 600,000 people dropping their coverage. This, in turn, could drive healthcare costs even higher, as younger and healthier individuals tend to forego coverage first, leaving a pool of sicker and more costly individuals. To meet their needs, insurers would have to charge even more. Matthew McGough, a policy analyst for KFF's Affordable Care Act program, explains this phenomenon. With those lower utilization people leaving the marketplace, which leaves only the high-cost users in the pool, it drives up premiums for those who are left, he says. The primary factors driving annual rate increases are the increasing number of people seeking healthcare and the higher prices associated with it. This can be attributed, in part, to an aging population and the widespread use of costly pharmaceuticals to treat chronic health conditions. However, insurers nationally and in California have identified other significant cost drivers, including tariffs on drugs and medical devices, enrollment and eligibility changes, and inflation. Most insurers are operating under the assumption that Congress won't extend the enhanced premium tax credits. According to KFF's analysis, the median premium increase for next year is 18% nationally, with the loss of subsidies accounting for 4% of this increase. So, what's the takeaway? This year's rate increases are a result of a unique combination of factors, including the expiration of enhanced federal subsidies and the general environment of uncertainty. As Matthew McGough notes, it's definitely a significant factor this year, and that, along with the general environment of uncertainty, are what is pushing these rates above what we've seen in the past few years. This article is supported by the California Health Care Foundation, CHCF, which is dedicated to ensuring people have access to the care they need, when they need it, and at a price they can afford. Now, it's your turn to weigh in. Do you think Congress should renew the enhanced subsidies? What impact do you think these changes will have on healthcare accessibility and affordability? Share your thoughts in the comments below.